Why are you throwing all the breads? What? Black fungus will come up. There are a lot of confusion or panic which is being created by this black fungus infection. So today in this particular video, we are going to see what is this black fungus infection, why some of the COVID recovered patients are getting affected by this black fungus infection, and there are some easy steps which is available. If you follow this step, you can get rid of this black fungus infection. This step is also going to be discussed in this particular video. So welcome to Smartbox. This is your KG. So we'll see a little bit outline about this black fungus. This fungus is actually black in color and it belongs to the family called Mucor. So hence we are naming it as black fungal infection or mucormycosis. Okay, so especially like bacteria, like virus, fungus is also capable of causing infection or disease only when if your immune system is weak. If your immune system is good, probably you don't have to worry at all. Our antibodies or our immune system will wipe off the fungi just like that. So why in COVID-19 patient this fungus infection is so common? So especially they give something called steroid to suppress our immune system. Why they are giving this steroid? Why we need to suppress our immune system? Come. So fungus is there, virus is there, bacteria is there. All these are antigen. So whenever COVID virus, SARS-CoV-2 virus enter into a person's body, his immune system will identify and then it will produce antibodies against that particular virus so that it can be killed or it can be deactivated. So this is the regular response which is being produced by our body against any kind of antigen which is entering into the body. So consider a bank. A group of robbers are trying to steal something from that particular bank. Okay, so what they are going to do? First 10 days they are going to do surveillance. How many employees are there? How many securities are there? How many CCTVs are there? Where is the vault? Things like that. So after that, on the 11th day or the 12th day, what they decide, they enter into the bank and start robbing. Okay. Similarly, with respect to SARS-CoV virus, it enters into the person's body. The first 10 days, what it does is multiplication. It starts dividing from 1 to 2, 2 to 4, 4 to 8, 8 to 16, things like that. The first 10 days, it is not going to be much of trouble. So in case if you are not able to take care in this first 10 days, our immune system is not capable to overcome the viral load properly, the worst situation is going to come after the 10th day only. Okay, so now in the case of robbers, the information is being provided to the police that so and so robbers have come, they have entered into this particular bank for stealing. So all the police officials are coming to that particular bank. Okay, so they start fighting against the thieves. They start shooting them. Okay, so in the case of our body, our immune system is identifying that the virus have come and they start fighting against the virus. So there will be a tough fight between the antibody and the antigen. That is, here the antibody is the police and the antigen, the SARS-CoV-2 virus is the robbers. So virus and antibody is going to have a fight. So what happens is that after a period of time, the police are killing most of the thieves. Okay, but still they have a doubt. So they keep on shooting. Array yaar, all the thieves are being shot down by you. Don't shoot. Some kind of information we need to give them, right? So similarly, in the case of our body also, our antigen or our antibody is so good in such a way that it can kill most of the antigen. Means the SARS-CoV-2 virus are being deactivated or being killed. But still, our immune system is producing more and more of antibodies. Immune system, you have killed most of the antigens. Please stop. Some information have to be provided to the immune system so that it doesn't produce more of antibodies, right? So this is being done by the steroid. So if you are providing the steroid, it will take care of the inflammation. And the second thing, it suppresses our immune system. So what we are going to say to the police, array, stand still, don't shoot. Okay. So now our immune system is weak for a good reason. Okay, almost most of the things are being completed, all the antigens are being killed. So relax, don't produce antibodies. Fine. So with respect to steroids, three things are very, very, very important. When to start a steroid, how much duration I have to give this steroid, what is the dosage of steroid that I have to use. So for example, you consider a police. We have to inform, right? We have to have an idea when we should call the police, how many police we need to counterattack the robbers, and for how long this police have to stay so that they can kill all the robbers. Same pattern, steroid, it is very, very important. So first 10 days, what is going to happen? Just the viral cells are going to multiply. It is not going to cause much of the trouble. The actual trouble will come in the second phase only. So if you're starting the steroid very early, then probably you are giving a free hands for the virus to attack or cause the trouble or make the situation more worse. Similarly, if you're calling the police so early, they don't have idea whether the robbers have come inside or not, but you are calling the police, shut. So it's just not needed at all, right? So if there is robbers, then you have to shoot. If there are no robbers and if they're not creating any kind of trouble, they have just come for the surveillance. They are not going to cause any harm. Just whomsoever employees is there, how many securities are there. In that time, if you are going to shoot, it is going to benefit anything. So similarly, in the case, if you are starting the steroid therapy so early, it is not going to benefit. It will make the situation worse only because your immune system is weak. Now the virus is having the free hands to multiply faster and make the situation even worse. Second scenario, if you are continuing the steroid therapy for a longer duration, again it is going to cause a problem because your immune system is going to get suppressed for a longer duration. This will give way for the fungus to enter into the body and cause the infection, mucormycosis or the black fungus infection. So what we are going to say, police stand still for how much long time? Yeah, you can enter into the bank and you can see whether all things are fine. You can save the people. Instead, if you are standing still, someone who is seeing all these things, okay, the police are not going to do anything, let me go inside the bank and see if something's available, I can take and run off. The same way, if your immune system is being suppressed for a longer duration, if you are taking steroid for a longer period of time than prescribed, then probably fungus can enter into the body and cause the infection. Okay. Don't take steroids on your own. To follow the medical advice which is provided by the doctor, when to start the steroid, how much dose I should take, and for how long I have to take. All these things will be provided or prescribed by the doctor. Follow that prescription. Do not take steroid on your own. First thing. Second thing is to maintain your glucose or sugar level. So if you are diabetic and if your fasting glucose level is more than 99 milligram per deciliter, and if you are being affected by COVID, then you are at a higher risk of getting a fungal infection. So take more of protein rich food and less of carbohydrate food. Maintain your glucose level as per the guidance provided by your doctor, especially the diabetologist. Okay, so I was mentioning, right, there is an easy step which is available, which if you are following, you can get rid of this fungal infection. If you are not getting COVID, your immune system is going to be great. So don't step out of your home or follow all the safety measures like wearing a mask, double mask, and social distancing, sanitizing. So if you are getting the opportunity to get yourself vaccinated to have a healthy immunity. If you are following all these steps, then you will not end up in fungal infection or COVID infection. So I hope this video was useful. So if you like this particular video, give a like, share to the people whom you feel it will be useful, and subscribe to Smartbox. Thank you.